But first, we're going to talk about Measure 10. Now, you may have seen earlier reports about it today. Hold on, stay with us. We're going to go in depth on information you've not yet seen. That's our big story tonight. Measure 110 is the law passed by Oregonians to decriminalize user amounts of drugs. A big part of the selling point with that law was the promise that hundreds of millions of dollars would pour into the recovery system and help those with struggle with addictions. Well, now Oregon's Secretary of State's auditors are out with their second report on how all that's going. Here's the cover of the report, which kind of sums it up, basically saying, yeah, it shows progress, but yeah, there's still big risks that the whole thing could get messed up. And before we get too deep into this, let's set the guardrails. The audit did not look at whether decriminalizing drugs is a good thing or not, and they did not look at how well the groups getting the money performed. This is only looking at whether the money was given out based on the priorities set in the measure that we all voted on, and other things like whether grants went to culturally specific and linguistically responsive organizations, and whether government groups which got the money used it to make up for other parts of budget shortfalls that they had. Okay. Let's set the baseline for this. The money to pay for Measure 110 comes from cannabis taxes. That money used to go to the state school fund, state agencies, cities, and counties. But now about 2/3 of that money goes to Measure 110, and those other groups are left with the scraps, about 1/3 of the money. The audit studied the time between July of 2022 and December of 2023, so right now. It found $264 million going to 233 applicants all over Oregon. Another 11 million went to Oregon Native American tribes or similar programs. One of the first things that caught my attention deals with the Oversight and Accountability Council. That's the local group that doles out money under Measure 110. That includes people who are part of the drug use recovery communities and other communities impacted by the war on drugs, along with leaders of recovery centers and some others. But it's a group without a leader right now. The audit reports that under a law passed by the 2023 legislative session, the group is supposed to have an executive director to help, run things. But as of this month, the job is still open. 2 people offered the job said, no thanks, because of the political volatility of Measure 110. So there's that. But the audit found that money is indeed flowing to groups across Oregon to help with drug addiction. One sign of the progress, peer support specialists who often spend more time with clients than doctors and others. The audit reports the number of peer support folks doubled from about 1,400 in early 2022 to about 2,800 now. So that's good. But now the not so good news. The group getting money for 110, they're not spending it fast enough, according to the auditors. From July 1 of 2022 to June 30 of 2023, groups which got grant money spent $95 million. That's just 1/3 of that $961 million in active grants given out through December. Now, providers told the auditors some of that delay comes from struggles with hiring staff members and also from worries about hiring staff with Measure 110 money that could then later disappear if the measure is changed. Auditors also found Oregon Health Authority staff who help oversee Measure 110 had trouble keeping tabs on the groups getting the money since there were just 5 grant managers covering more than 230 grants. The team also reported that lawmakers may not be able to evaluate how effective Measure 110 is. That is something that the public wants very much and that lawmakers want very much as well. The lawmakers want the info by December of 2025. However, the auditors warn that the system needed lax metrics. The system that is needed to track the metrics has not been there long enough. That's what I'm trying to say. In other words, there's not going to be enough numbers to show what's happening. And since there was never a good baseline established before the law took effect, it'll be tough to know for sure if it's working as planned. This graphic there under the red circle shows what auditors think will maybe not be available for lawmakers by then. It includes client health outcomes and whether there were increases in treatment providers, culturally specific providers, access to harm reduction services, and housing, and client access to housing, which, is a lot to not know. Finally, the auditors looked into something called supplanting, which is when a government agency uses Measure 110 money to make up for their budget cuts. Turns out OHA not really tracking that, but the auditors say that based on the folks they've interviewed at various programs, it does not appear that is happening. But they did find that Washington County and Lynn County actually did use Measure 110 money to replace expiring state and federal grants, and OHA leaders told them that was not really supplanting. Really? Finally, here's what the auditors suggest when it comes to figuring out if Measure 110 is being effective. First, get a strategic plan with specific outcome metrics and timelines, and get it in front of the legislature in February. Second, work with the folks getting money to better track and report specifics on staffing, service expansion, and capital projects. Also, youth services and virtual services and culturally and linguistically specific services. And then also get better data from the groups getting the money so that you can see where it's going and what's happening with the clients.